A lot of my patients want to know, are implants worth it at age 65 or even 75? And I've been doing this for 20 years, and I can tell you that doing full mouth dental implants, permanent implants, at any age, whether you're 19 or 90, is one of the best things you're ever going to do in your life. Hey guys, Dr. Heath Lampee here with Teeth in 24. I do this procedure, the Teeth in 24 permanent implant procedure, on patients in their late teens, 20s, 30s. It's amazing what young people are doing to their teeth now. Most of my patients are in their 60s and 70s and in their early to mid 80s. I'll give you an example. My patient Craig, I just treated this week actually. He's 78 years old. And I saw Craig for the first time 10 years ago when he was 68. He was about to retire then. His teeth were failing. I told him, Craig, you need to have the rest of the teeth out. You need implants. If you don't do that, you're not going to be liking life. So Craig, like a lot of my patients, he's like, I don't think I'm worth it. I don't think this is worth the money. And so he went to a cheaper place and he got dentures. And for the last 10 years, Craig has kind of silently been crying. He hasn't been able to be social. He hasn't been able to smile as big as he wants, and he's got a larger than life personality. Just this week, 10 years later at age 78, I did full mouth implants for him. And for the first time in over 10 years, he can smile. He does not have dentures. He does not have partials. He does not have the thick layer of plastic on the roof of the mouth. And because he decided to finally invest in himself, and it took him 10 years of struggling, he's going to want to live longer. He's going to want to be social. Him and his wife are going to go on more trips, more cruises, and it's my goal to give you that. And so at age 65, 75, 80, I promise you are so worth it. And I do have all these patients, like Craig, tell me afterwards that, Dr. Lampee, this is the best thing I've ever done. I wish I did this 10 years ago. That's what Craig just told me. And so these are the real stories that I see on a weekly basis, because I understand, spending a certain amount of money on your teeth in your 60s, 70s is kind of scary. It's like, am I worth it? Am I going to live long? Am I going to have enough meals to make this worth it? Am I going to be able to amortize this enough over the next 10, 20 years? And yes, because if you imagine yourself as not having teeth, not being able to smile, not being able to eat what you want, not being able to go out, what's the point of living? And so if you've saved to do this, or if you can finance to do this, it will be worth it. You are not going to regret it. I want you to realize your full potential in life, whether you are 18 or 65 or 75 or 80, because we all have 24 hours in a day. We all can do these amazing things. I don't want you to be shut-ins. I don't want you to avoid eating steak. I don't want you to not want to smile at your daughter's wedding. You are worth it. Invest in yourself. Invest in today so that, like Craig, you don't just have 10 years of just misery where he finally came in at age 70. He's like, okay, just do it. Just give me these implants. I should have done it 10 years ago. I'm sorry. I went the cheaper route. And him and his wife, like I said, his wife was pushing him to do this, where she's like, I want my Craig back. He's worth it. It will be worth it. We are going to have a relationship, me and you, for the rest of your life. I'm going to see you once a year for the rest of your life to make sure that your implants are doing well, that the investment is worth it. Because once a year, I want you to come in for a cleaning, but I also want to know what you're doing in life, what you're eating, where you're going. And I want to know how big your smile is and how happy you are. My patients in their 60s and 70s and 80s often wonder, so what are these implants that you're going to give me? I've already dealt with dentures. I've dealt with partials. I've dealt with broken teeth. How is this going to be different than the last 60, 70 years of my life and all the other dental visits that I've had that I've wasted all this money on? How is it going to be different? And so what we do is we're going to give you something that looks a little something like this. This is not a denture. It's not a partial. This is a fixed implant bridge, also known as Teeth in 24. And so what it is we can actually, I haven't screwed this in yet, but we put implants in the jaws. We put 4 to 6 implants in the jaw. Some people have enough bone for 4 implants. Some people have enough bone for 6 implants. And oftentimes for my patients in their 60s, 70s, and 80s, 4 implants is pretty darn good to do. And so what we do is we will actually put those implants in, and I'm going to place these teeth, and I'm actually going to use a torque wrench and screw all of the implants in. So this never comes in or out, okay? It's going to stay in there. Now this is made out of zirconia ceramic, the strongest, most durable restoration that I can give you. You can eat steak, you can eat corn on the cob, you can eat apples, bite into a carrot, eat your salad. This is so strong, so durable, do what you want with it. Now what's so cool, we highly customize this for everyone. It's going to look natural. People are going to be like, oh, you just have a nice smile. Now, the color that we choose for this, that we choose together, you can go yellow, white, you can go super white, you go Vegas white, I don't care. I'm going to guide you and give you something beautiful. But the color that we choose for this is not going to stain or fade. You're going to have that beautiful smile, the same color that you chose from day one for the rest of your life. So the rest of your life, you're going to be smiling, this beautiful smile. You're going to be able to eat whatever you want. You're going to go out, you're going to be social, you're going to be with your friends, you're going to be with your family, you're going to travel, and you're going to love life just a little bit more. It's going to be a little sweeter because you did this. Thanks so much for listening, and I look forward to helping you with your implants.